one last aspect of the pharynx that deserves some attention is the pharyngotympanic tubes. So the nasopharynx then contains the pharyngotympanic tubes. There's one on each side, and I'm just going to tell you these are also called the auditory tubes. And you will also see them called the eustachian tubes. These are all names for the same thing. And there is one tube going from each side of the nasopharynx to each middle ear. What did I just say? What I said is that you've got two pharyngotympanic tubes, one on one side and one on the other side. And they go from the nasopharynx. It's a tiny, tiny little tunnel of an opening going from your nasopharynx to the middle ear. The middle ear is the portion of your ear that has air in it, and that also contains the three little bones known as the ossicles. So it's on the other side then of the ear tube here in your skull, the external auditory meatus, which you also learned when you were studying the skull. So on the other side of that is a little open area that is known as the middle ear. So the middle ear has air in it, but the problem is that the air has to be at the same pressure as atmospheric pressure. So these openings, the right and left nasopharyngeal tubes, that is to say, these openings then allow you to equalize air pressure in your middle ear. Basically, that little pocket of air in your middle ear has to be at the same pressure as atmospheric pressure. But the problem is that atmospheric pressure can go up or down depending upon where you are. It can also vary with the weather, but it's more obvious when we're talking about altitude. So if you have ever gone up into an airplane, you may have felt a little bit of a pressure headache, or you may have heard that popping sound. That popping sound is basically air passing through the pharyngotympanic tube so that you wind up having equal pressure in your middle ear as on the outside, because as you go up into an airplane, there is less air pressure surrounding you when you are at altitude. You can also notice this just on a hill. If you're in a car at the top of a biggish hill and you go down fairly fast, you will actually also hear that popping sound, which is again going from where the air is at a lower pressure up high to where it is a higher pressure at the bottom of the hill. If you do that fast enough, you will actually again experience that popping sound, which is the passage of air through your nasopharyngeal tube, thereby equalizing the pressure between the air pressure in that little pocket there and the air pressure in the atmosphere that's surrounding you. So as I said, that's what the nasopharyngeal tubes do. And just so you know, this is why swallowing or chewing, which basically manipulates the tissue in that area, then can help you adjust to air pressure changes. So again, if you go up into an airplane and you start getting a headache, people may suggest that you chew gum or something like that, because it is just manipulating the tissues there a little bit such that you can open up that opening and allow the air to pass through. And that's the end of this lecture.